Jai Srimanarayan. Sri Ramanja Seva Trust has come forward with a useful initiative of free fibro test on 31st of this month in Ramanja Mandir. Liver is the largest internal organ of our body. Its main function is to metabolize the food we take and also to get rid of the toxic materials in our body. Modern lifestyle, alcohol consumption, and infections have caused huge damage to our liver. Initially, these factors cause inflammation in the liver. We term that as fatty liver. As the infection grows on, aggravates, there occurs stiffness in the liver and also an irreversible scarring known as cirrhosis. Cirrhosis is irreversible damage to the liver tissue and which cannot be normalized again. If we find out or diagnose this condition in the earlier stages, it would be very easy for us to come to a treatment. We can treat the case effectively. Normally used test to assess the function of liver is liver function test. Liver function test, unfortunately, when deranged, the disease has already been advanced. The commonly used first test is ultrasound abdomen, where we can detect the earliest stages of the fatty liver. But the limitations of this type of technique is that it has some inter-observer limitations like biases. The second modality of diagnosis is liver biopsy, where a piece of liver is taken and tested to find out the extent of shrinkage or inflammation. There are some problems associated with liver biopsy. The first one include, as it is an invasive procedure, there occurs common risk factors involved in it. The first risk factor include a huge bleeding, as liver is highly vascular organ and it is also painful to certain extent. Thus comes the use of fibroscan, which is an effective alternative of liver biopsy. Fibroscan is an ultrasound machine which we term as frequently liver elastography. It helps us to not only assess the degree of the swelling or fat but also the stiffness of the liver. The best part of this test is that it gives us the quantitative measure of the disease, which when compared with the target can act as a framework for planning the treatment of the patient. The patient is required to be fasting for at least 2 to 3 hours prior to the test. The most beautiful thing of this test is that being a non-invasive test, it has no side effects and is quite safe. The test is not only painless but is also repeatable. By repeating the fibroscan after 2 or 3 or 6 months, by recommended medication, we can see improvement in the patient. We shall all utilize this wonderful opportunity and get our liver checked. Remember the date, 31st, Sunday morning 9 to 3 in Ramanja Mandiram.